what's different from what you're doing for folks who deal with vertigo than what they can get, down the street at their local medical or traditional chiropractor's office?
Well, that's a really good question. We're an upper cervical specialist, so we deal with pressures at the brainstem and the spinal cord, which is right below the skull. There's a special bone called your atlas, and it affects not only the spinal cord, but pressures on or flow of the cerebrospinal fluid, which causes pressures into the skull. Mm-hmm. And those things combined tend to cause big problems with vertigo, and so most traditional chiropractic offices really don't address this particular issue. Medical offices were really confined to medications, which most of the time don't work, or they're temporary at best, and or they're forced doing Epley maneuvers or some kind of weird things that don't have any really lasting effect. And what we're looking for is, why is that riding reflex, that ability to keep yourself planted, why is it not working right? And it turns out at the base of the skull, there's a portion of the nervous system that tends to be involved with that. So our specialty, we focus on that, and it's one of the reasons why we're specialists in this particular realm. And we have people driving from or flying from all sorts of the parts of the country just for this particular type of care. And I'll tell you, it's a really scary thing, because it's a life changer. Vertigo affects, even in mild cases, it's a sense of unease. Is it going to hit while I'm driving, or clumsiness, or things like that? It's really it affects them psychologically. It's been there for a long time. And in extreme cases, Joe, it's they can't leave the house. Pretty much they're stuck, and that's not a way to live your life, for sure.
Sure. Yeah, it's such an interesting situation, because to the people that deal with it, it consumes everything, right? I mean, it dictates their social, can you make it to work today? Can you go out and celebrate with this person? And you're always having to account for it, right?
Yeah, they wake up wondering if the world's going to be spinning, or if they're going to throw up when they move. It's really the deal.
So awful.
Yeah.
And so this is something that you've really niched yourself out into in terms of specialty, because I know we see a tremendous amount of folks that are coming in with vertigo issues.
Yeah, we do. It really is. It's been quite a specialty for us, and we've had a pretty good success rate with it, actually, to be honest with you. And I feel pretty privileged actually to serve them with that.
So when I think of chiropractic care, because we're a chiropractic office,
yeah,
obviously I have some experience with it myself.
Yeah.
So I have some of the issues out there demystified, but a lot of people, they're thinking, when I'm thinking of a chiropractor, it's clean and jerk, it's elbow to the back, jumping off the top rope, kind of
WWF moves. Yeah.
Yeah, quite a bit. That's not the experience that you're providing folks, is it?
No, it's not. In the upper area, in the upper part of the spine, it's unique. The architecture and the biomechanics of the spine work different, and so it requires a high level of specificity. It requires an analysis that's not ordinary variety. It's quite complicated, and it requires an adjustment that's super gentle and very specific. In fact, most people describe it as just pressure, and it's obviously a little more than that, but there's no popping, jerking, yanking, or anything of that nature. And that's because it can't be. That area is very special, and it requires a very gentle approach. So yeah, there's none of that medieval stuff, as they say.
Gotcha. Yeah. So it's really gentle and very specific. And I know we've got quite a bit of equipment to make sure that we're, this isn't just a general, I think it'll work. We'll wait and see. I mean, this is
not like that at all. You're right.
We're using a lot of data here, right?
Yeah, it's not only that. We actually will measure, as you know, we measure the nervous system in several different ways before we even take a case on. But even more importantly, with our NUCCA work, we do very specialized, what amounts to 3-dimensional films of the atlas and the occiput and the skull. And then we do our correction. And then we do post films and remeasure again to make sure it's reduced like it's supposed to. So there's a lot that goes in that you won't see in really any other kind of chiropractic offices. It's very specialized that way. And this way we know when we get that correction, we can measure it and see it. It's the real deal.
So if somebody catches wind of this video and they're learning more about your Vertigo program, what's the best next step for someone like that?
Well, the first step is to contact our office. We hold a class twice a week on what we do and how we affect that. And I do a lot of examples with vertigo, and I have some neat case studies on that for them to kind of see. The step after that is if they find that we're right for them, then we do an exam to find out if it's really going to be a case we can take on. We look for pressure at the spinal cord. We have ways of measuring that. If that's present, then we start our our NUCCA process. And if it's not, well, then we've eliminated one big negative, and we can focus on some of the other causes. But the nice thing about addressing this here is that if it is the upper cervical spine, which it is in a lot of cases, we're addressing a cause. So it's not just a band-aid approach. It's about how can we fix you, and then show you how to keep it that way. So we're not having to rely on a medication to falsely mask it up, and then when the meds wear off, all of a sudden you're back to the same boat, right? That's not the idea. We really want to fix this thing so that you can maintain it easily for the rest of your life.
Gotcha. Well, great. Hey, I appreciate that we were able to kind of sneak away from some patients for a little bit and record this. As always, if you're watching any of our videos here from Ennis Chiropractic and you have questions related to the content, if you're looking for more information about the processes and procedures we're talking about, or if you just want to talk about your case in general, leave us a comment, go to the website, use the contact forms, give us a call. Calls by phone. Well, we have one of those, works quite well. And let us know. I mean, we want to make sure that if this is an opportunity where we can help you, that we do so the right way and as quickly as possible. I mean, I can't imagine the dealing with this and living with it, particularly in severe cases, and not knowing where a solution is when we're here the whole time, looking out for those folks. So we're currently accepting new vertigo patients right now. We're looking for some, and you can learn more about the screening process as well as our discovery classes over at ennischiropractic.com.